Good afternoon everyone. I am Dr. Zoeb Kachwala. Today I am going to talk about the importance of time in dental care. Now before we begin, let me just share this on my timeline. Okay, just a short introduction about myself. I am Dr. Zoeb Kachwala. I am a general dentist. I work with Clover Medical Centre. I did my graduation from Government Dental College, Mumbai. As a general practitioner, I do all routine procedures, but my love and heart is in endodontics, which is basically root canal treatment, and a lot of cosmetic work as well. Now, what exactly do I mean by the importance of time in dental care? When I was a student, the first thing that we were taught to do our diagnosis and other thing is to ask the patient what is their chief complaint or what is the problem that they are facing. Now, when we did that, 99% of the patients came to us with a chief complaint of pain or bleeding gums or something else. Now, that is really a sad part. Why do I say that? The reason being that those 99% people waited for something to go wrong before they sought out to do something about it. And when it comes to dental care, every day waited is a day wasted. Now, only 1% of people came to us saying that they don't have any symptoms whatsoever, just want a routine checkup to know what is going on in their mouth. Now, to put it in simpler terms, let me say this. In Dubai, we come from various parts of the world, various nationalities and various languages, but there is one language that we all speak, and that's our cars. So let me ask you this: do we all wait for our car to break down in the middle of the road before we take it to someone to get it checked? Or do we get our servicing done every 6 months or every 10,000 kilometers, whichever way it may be? And it's funny how we can find time to get our car serviced for the fuel stops, air, other things, but we don't have time for ourselves. And the thing is, we're going to use this body, our mouth and everything else a lot longer than what we're going to use for our car. Now, with time, the dental treatment which may be required for you is only going to get more and more extensive, and as it gets extensive, it is also going to get more expensive. First, I will talk to you about few of the common clinical scenarios or examples that we come across in our routine practice. Now, when somebody comes to us or calls us for an appointment, most of the time that is because of pain. Now, once you have a toothache, in majority of the cases, the tooth will end up needing a root canal. But that did not happen overnight. Even though the pain may have started a night before or maybe 2 days before, the problem had actually started way before that. Let's say, what is a root canal today? Maybe few months back, that could have been saved with a restoration or a filling, as we call it. Go few more months before that, and it probably needed a very small filling. And if you go few more months in the past, it was probably something that just needed a sealant to seal off those pits and small cracks and fissures so that nothing gets stuck over there. But because of that continuous ignorance which has been taking place, because the person waited for something to happen before they come to us, things have now escalated from something as simple as a sealant or maybe just simple brushing to a root canal treatment. Put it this way, for those who have actually gone through a root canal treatment, imagine you could have avoided the entire root canal treatment, the pain that you underwent before starting the procedure, the multiple appointments of a root canal treatment, the cost and financial implications of that, simply by brushing after each meal. That's all it would have taken at the beginning. But unfortunately, time was not used in this dental treatment. Time was ignored, and over a period of time, something as simple as a filling or a sealant ended up being something as great as a root canal treatment. But before I go on and talk about other people, I'll just reintroduce myself, this time not as a dental doctor, but as a dental patient. as you may have noticed, or some of you may have noticed, I'm undergoing orthodontic treatment myself, which basically means that I have braces on my teeth to correct their positioning, to get them in the right positions. Now I'm 31 years old. This treatment should probably have been done 2 decades back, but I'm doing it now. The reason being, what was not done at that age started giving me issues at this age. So over a period of these 2 decades, because my teeth were not in the right positions with relation to each other, some of them were taking way too much load for way longer, and some of them started chipping off. I decided to act rather than wait for things to get a lot worse. Now, what would have been a short treatment at an early age? Let's say if I had done the same treatment when I was 12 or 14 years old, the treatment would have been a lot faster and the results would have been better and more stable. Reason being, it is always easier to guide the teeth in the right positions while they are growing or while they are erupting into your mouth, rather than doing it at this age when they are used to being in a certain position for so long. So now suddenly from that stable position where they have been for so long, we need to pull them to a different position. So that's going to take longer. So I would say again, as I said, the treatment, had it been done on the right time, would have been a lot better than what it has been done now. But better late than never. And that's why I decided to go ahead with this treatment. Apart from this, consider that most of the treatment or the orthodontic treatment is done at the age of 12 to 14. This could have been avoided only and simply by a routine checkup between the age of, let's say, 6 to 12. That is the period when the milk teeth are falling off one by one and the permanent teeth start erupting. If only certain milk teeth which had fallen off earlier were replaced, or let's say certain milk teeth which did not fall off on time, resulting in your permanent teeth erupting in whatever space they could find, or maybe they didn't erupt at all, that is what caused this whole problem. So that entire thing could have been avoided during those 6 years by just a proper routine checkup follow-up, so that we make sure things go as they should. If it is not done at that time, you end up having teeth in wrong positions or wrong alignment, and then braces treatment needs to be done to get them in the right positions. In fact, time is such a game changer when it comes to orthodontics or other treatment as well, that braces is just a part of doing the treatment. Another part is maybe at an earlier age, the entire jaw growth could have been modified so that it could accommodate all the teeth in the jaw, rather than the teeth fighting each other to find some space in this mouth. So that entire thing could have been done at an earlier age, or rather during the growing age. That's not possible once the growth is complete. So this is the importance of time when you're doing dental treatment or any sort of dental care. Okay, just the questions have started coming in. I'll be answering your questions at the end of this entire thing. Now, another thing which I did for myself was that I had about 12 fillings or restorations done on my teeth about 10 years back. Now, I didn't have any problems per se, but being a dental student, one day I walk into the department, get a consultation done for myself, and I was informed that I had 12 teeth with cavities which needed fillings. Now, being a student myself, I knew that this is real. This is not going away on its own unless I do something about it. And with the help of my professor, I got those 12 fillings done. Now just imagine if I had not done those 12 restorations back then, waited for something to go wrong, that I feel it in my mouth, today I'd be sitting here with 12 root canals in my mouth. Or maybe even worse, some of them might have been broken to a point where it might have required to be removed. Now all of that was avoided 10 years back by doing something as simple as a filling. That's the importance of time when you do dental treatment. Apart from that, we'll talk about some other scenarios now. Let's say pain was one that we discussed. Another common issue that people complain is about bleeding gums and having bad breath. Now, where does this bleeding gums and bad breath coming from? The biggest cause for this is dental tartar or dental calculus as we call it, and tartar as it is known commonly. What exactly is tartar? The food that you eat, it mixes with the bacteria which are there in your mouth. Now, if you brush properly at night, remove it, it goes away. If it stays around your tooth for a few days, yes, it will stay around your teeth for a few days if you don't clean it properly. That will slowly turn into tartar. Tartar is like a hard stony mass. It's gonna irritate your gums. So imagine that whatever you ate for Christmas is still there in your mouth in the form of tartar in some corner of your mouth. That has been continuously irritating your gums. Come Valentine's Day, your gums will literally be bleeding, weeping for help. That's your body's way to tell you that something is wrong, do something about it. Now, if you, let's say, ignore it for some reason, the bleeding is going on, it doesn't hurt, you decide to let it be the way it is, what's going to happen next? That tartar is going to trap more and more food, more and more bacteria and keep growing. It's going to keep irritating your gums. Since you fail to do something about it, your body is going to improvise. What is it going to do? The gums will start moving away from the tartar. That's how the teeth start shaking. Reason being, your gums are moving away. The root gets exposed. The exposed root then starts giving you issues of sensitivity. There are periodontal pockets or gum issues where more and more food is going to get accumulated. And this is not happening overnight. I am talking about roughly years of this treatment going on. And your ignorance or the person's ignorance in not doing something about it or waiting for it to become so grave that you do something about it. As I said, over a period of time, this is going to keep irritating your gums. Your gums are slowly going to keep migrating away from the tooth. At a certain stage, your body, because you didn't do about it, is going to improvise further. It will stop discriminating between your tooth and the tartar, and it will start to get rid of the tooth itself because the tartar is around your tooth. That's where the teeth start becoming shaky, and each passing moment of time, the tooth gums get destroyed further and further, and your tooth becomes more and more shaky, and eventually it's gonna fall off just like your milk teeth. But trust me, this time there is no other tooth which is gonna come and replace it. Now the next thing with this is halitosis or bad breath. Where does that come from? The same food that you ate is literally rotting in some corner of your mouth, giving off gases, which is the reason you have bad breath. It may be stuck just around your tooth in certain corners. It may be certain cavities where the food is stuck. It may be stuck in your gums, or it may be stuck around your cheek and your tongue as well. But because it was not removed on time, the food which stayed there for that long is now rotting and giving off gases. That's the reason you have bad breath. And all of this, the bleeding gums, the halitosis, shaking of teeth, sensitivity, could have simply been avoided by simple brushing and routine checkup and cleaning. Let's say you get a cleaning done every 6 months. Remove the tartar and followed by proper maintenance on your side. And this problem would have been avoided from beginning. It wouldn't even have started. Forget reaching a stage where you lose your tooth. Now, another issue that we face very commonly is somebody wanting to replace a tooth. Now, the first question that we ask or we would like to know is, why did you lose the tooth? Because that's of grave importance. Was it because of decay? Was it because of gum issues? So you realize that a tooth, a natural tooth, by itself is supposed to last you for decades. In fact, some of my patients, I have seen the teeth to be there, a complete set at the age of 80 years. So what should have lasted in your mouth for 80 years was destroyed to a point that it had to be removed, or it was removed on its own, in a period of 30 or 40 years. That's only because of continuous neglect and not doing the right treatment at the right time. And then it goes on getting worse from there on. Another very common problem that we see nowadays is with children. The difference in diet which has come in these days, the difference in lifestyle which has come these days is affecting them at a rate much faster than it does for us. So it is very important that the milk teeth which are there in your child's mouth, in your son or in your daughter's mouth, be taken care of. Don't think that these are milk teeth, they are eventually going to fall off and they are not important. They are extremely important, and that is the reason I mentioned previously that if it doesn't fall off on time, we remove it. If it has actually been lost earlier than it should be, we replace it. We need to maintain that space so that the permanent tooth knows where to come. To conclude with, I would like to say that your mouth needs certain amount of time and effort from you. Now it's up to you how you utilize the time and make that effort. You can either brush every night properly, let's say 5 good minutes, learn how to brush properly, come visit a dentist for short appointments where we just do a checkup or a routine maintenance cleaning, and you're fine and good to go, just like I have done over the past 10 years. The other option is wait till something goes wrong, ignore it for some more time, still it will go wrong, ignore it for a little more time, and eventually after 10 years it will be a painful, terrible mess where you come to us. We have to do extensive procedures to restore what has been lost, and yes, with extensive, as I said, it will become expensive as well. So you can utilize the time and money at your home for short dental visits, or you can have long sessions with us for doing procedures like root canals and all. Completely your choice. Now I'd like to answer the questions that have been asked. Okay. The first one is, are implants permanent? Okay. First of all, technically the answer is yes as well as no. Are implants permanent? Yes. Implant is basically a titanium prosthesis which we place into your jaw. It fuses with your bone. Now this bond between your implant and your bone is technically permanent. It doesn't deteriorate over time. It's osseointegration as we call it. Will it last in your mouth permanently? I doubt it. The fact that we are placing an implant in your mouth means you lost the tooth for certain reasons, which may be gum or decay. Now as I said, the best thing in your mouth is your natural tooth. If you manage to lose that so early, I really don't know how we as dentists can give you something better than what God has given you. So it's ultimately up to you to take care of it. If you do that, yes, it should last you till your grave. What is the best toothpaste? Well, before we go to the toothpaste, I'll go to the other part of oral hygiene. Now, toothpaste is one part. The most important part for me, personally I feel, is your toothbrush. So what is important is having a good brush and brushing properly. Today, everyone has a smartphone. Everyone knows YouTube and watches videos on YouTube. How many of you has actually used YouTube to know what is the correct brushing technique? Personally, I'll tell you, I've had a patient who was having a discussion with me. He was a teenager and father brought him in for a couple of root canals, and basically he knew everything about his smartphone as well as my smartphone. The specs, the camera resolution, the RAM, the ROM, and so on and so forth. And the moment I asked him that, is he scared of getting the root canal done? He said, no doc, because I saw it on YouTube. I know you're going to give me anesthesia, it's going to pinch maybe a little bit, and later on it's going to be absolutely fine. You're going to put some sharp needles inside and things like that, but it doesn't hurt. I've seen all those videos. And I asked him, are you planning to do the root canal yourself? He said, no. So then why did you YouTube doing a root canal? You should have YouTubed how to brush. Have you done that? Like no. So tell me, Mr. Specifications, what brush are you using? It's a good one, blue color, 15 dirham one. Like, so that's your definition of a good brush? Do you know what bristles are there? Is it multi-tufted, uni-tufted? Is it soft? Is it medium? Is it zigzag, crisscross? What is it? Like, I don't know. Find out. That's important. You're going to put that in your mouth. Your phone is going to be in your pocket. Maybe you'll use it once a day. Your toothbrush is more important because it goes into your mouth, and your mouth is the entry point of your entire body. So how can you have a healthy body if you don't have a clean mouth? And how can you have a clean mouth if you don't brush properly with a proper brush and toothpaste? Answering the question, any toothpaste which is certified by our local authorities is good for you. Some of the common brands are Pepsodent, Colgate, Oral-B. They're available all over the world. So they have gone through all sorts of tests and local specifications which are required. So you can trust those brands. But as I said, the important thing is your brush. And again, the importance of the brush, soft so that it doesn't damage your teeth or your gums. Small so that it will go right till the end and clean everything in every corner of your mouth. And zigzag so that it can clean between your teeth. And other than that, as far as the toothpaste is concerned, now this is for regular people who have specific problems like sensitivity or severe bleeding of gums or bad breath. There are different toothpaste. For sensitive teeth, there are anti-sensitive toothpaste. For people who have bad breath issues, you can use the ones without having certain amount of mouth fresheners in them. But in general, any toothpaste which is certified by our local authorities is good. Next one is, what is the best time for braces? Okay, now braces is basically a mode of treatment. What we need to know, it was is wrong with the teeth. If it is just the positioning of the teeth, yes, it will need braces. Ideally from 12 to 14 once the permanent teeth have erupted. But in case the problem is somewhere else, not just the positioning of the teeth, then the game changes completely. For example, my generation or the people who were born in 80s and 90s, the problem was teeth being in the rotten position. But what I see today is that children are spending far more time with their laptops, with their cell phones, TV, tablets, and sitting in front of the television like this, or maybe in their smartphones like this, which results in this chin or your lower jaw not being able to grow the way it should. In that case, braces can correct the alignment, but it cannot make your jaw grow. So then you need to come a little earlier so that we can modify the jaw growth. So then, as I said, it depends on the problem for which you're looking braces as a treatment option. So it is more important, your child that you're looking for this treatment for, consult with an orthodontist at the earliest, know what is happening, and then do the treatment accordingly. Don't wait for the age of 12 to 14 just because I said it. It is more important that a clinician takes a look what is happening inside the mouth, what is happening in the head and face area, and then accordingly do the treatment. Next question, sorry. I had a tooth removed recently. When should I get it replaced? What if I leave it like that? Okay. Now again, most important part would be, why did you end up losing the tooth? That will decide how we go on to replace it and many other factors. And depending on how we are planning to replace it, the time frame depends on that. Whether you're going for an implant, whether you're going for a bridge. Irrespective, what I basically tell all my patients is, get it replaced at the earliest possible. Reason being is the second part of your question, that what if I leave it like that? Imagine you're sitting in a car, 4 people in the back row. The moment one of them is going to leave, the other 3 will adjust themselves and sit comfortably, isn't it? That's exactly what your teeth are going to do. So you pull out one tooth or you lose it for some reason and you don't replace it, or replace it at a later stage, other teeth are going to start moving into that empty space. As I said, if you ignore your body is going to try and do something on its own. So you didn't fill up the space, or it wasn't filled up in the right time, your body or your teeth will start moving in that space to close that gap. Also, if you're not comfortable eating on that side, you end up eating on the opposite side. Which means, let's say hypothetically, I remove a tooth on my right. I'm not able to eat or chew properly on that side. I start using the left. That means these teeth start doing double the work than what they should have. And not only the teeth, my jaw, my joint, the muscles, everything are doing double the work than what they should have. So then get it replaced at the earliest possible. Next question is, I have a black spot on my tooth. Can I wait till I go to India next month? Okay. You want to get your tooth treated in India? That's fine. You want to wait for 1 month? That's not fine. As I said, the entire thing is the importance of time. Now what I suggest for you is visit a dentist at the earliest, find out what that black spot is, what it is doing to your tooth, and then take a call of what you want to do from there on. But if I were you, whatever the treatment, I'd do it at the earliest. Next question is, which is the best mouthwash? Okay, first of all, the term mouthwash is very wrongly interpreted by patients, very commonly asked question. So let me tell you this, a mouthwash does not wash your mouth. Okay, so don't think you can replace it with, say you don't brush properly and you just rinse your mouth with a mouthwash and think that the problem has been solved. First thing is, you brush your teeth properly, get all the food out, then rinse with water, get all the toothpaste out, then you take your mouthwash, swish it around so that wherever your brush did not go, it will go in and flush the bacteria out. Now if you don't brush properly and you use a mouthwash, well, if food is protecting the bacteria, there is nothing a mouthwash is going to do other than just give you a false sense of freshness and cleanliness in your mouth. And as far as mouthwash is concerned, again, there are plenty of products off the shelf. Whichever is having chlorhexidine in them, you can use those depending on what your doctor has advised for you. So it's best you first go visit a doctor, why you want to use a mouthwash, and usually mouthwashes are used for a specific period of time. It's not something you use all around the year. It's for a limited period and then you stop it. How often should I get a cleaning done? Alright, now that depends on how clean you are keeping your mouth. So let's say you get a cleaning done today and you brush after every meal, you brush properly at night. That's what I mean by brushing. You don't smoke, you don't have a lot of tea or coffee. 6 months is a good period to come back again and get a cleaning done, so that wherever your brush did not go or areas which were not cleaned properly, we do it for you. Now, people who don't have well-aligned teeth, the teeth are crooked, so food has a tendency to get stuck in many places, who are not very good at the brushing or don't brush properly at night, very important, who smoke or have a lot of tea or coffee, that time period comes down from 6 months to, let's say, 5 months, 4 months, or even lesser. So it all depends on how clean you can keep it after it has been cleaned. But ideally we say twice a year, so that we remove and also we can keep an eye on what else is happening in your mouth. Next question would be, I am facing a lot of dental problems after my pregnancy. What can I do about it? And what should I do to avoid these for my child? Okay, first of all, I'll just clear one part of it, that the problems that you have related to your teeth and gums after pregnancy is not related to the baby. You are not losing calcium from your teeth. The problem that you are facing is because of lack of oral hygiene. Let me put it to you this way. Basically, we have 3 meals in a day. When you're expecting, when you're pregnant, you need to have more meals in a day. So every 2 hours, 3 hours, or maybe even less, something is continuously going into your mouth. Are you brushing each time? No. So that food has been there around your tooth, and again some food is being introduced into your mouth, and that is helping the bacteria cause a lot of problem in your mouth. Once you deliver, you have your baby, the problem goes to the next step. Now you have to eat according to the child, you have to sleep according to the child, may wake up in the middle of the night, then go back, maybe you had a snack, you didn't feel like brushing, you were too tired. So the entire problem of dental issues around or after pregnancy is because of lack of oral hygiene. It's not because you're losing calcium from your teeth. Whatever is the issue, visit your nearby dentist at the earliest, get it sorted. It's only going to get worse, and it's going to affect more and more teeth, spreading one after the other. As far as your child is concerned, the milk teeth will start erupting at the age of 6 months. Goes on till 2.5 years, and then the permanent teeth start coming from the age of 6. The moment the tooth erupts in the mouth, it is prone to decay. So the basic care that you have to take is, once the baby has fallen asleep, wash your hands, wipe a clean cloth around your finger, put it inside your child's mouth, and just wipe as much as you can. The gums, the tongue, the tooth, and reduce that milk which is there. There is something which is known as nursing bottle caries, which has been extensively seen these days. So by the time your child is 2 years or 2.5 years, half of the teeth are gone beyond repair. And that is because of something which started at 6 months. And you can avoid this entire thing simply by the technique that I just told you. When you visit your dentist, he will give you some more in-depth insights on how to avoid these things, what to look after, the diet, the frequency of diet, and everything. If you have children in the age range of, let's say, 6 to 14, take them to the dentist immediately and see what's happening. As I said, that's a very important age, because if there is any decay in the milk teeth, during these 6 years, it will spread to the permanent teeth as well. And you don't want to lose those permanent teeth so early in life. Now, the next question is, how often should we get cleaning done, and my teeth become loose after I do cleaning? Alright, now this is a very common question which is asked to us, that teeth become weak or they become loose after cleaning and they feel gaps between your teeth. This is again a time related phenomenon. So for example, the tartar that I spoke about has been accumulating slowly over a period of time around your teeth. It didn't happen overnight. But when we do the cleaning for you, that's done in a single session of, let's say, 20 to 30 minutes. So that is why you feel that sudden sensation that something has been lost from your mouth. Because that tartar, which had been gathering there slowly over a period of time, you didn't feel it, but the moment it's gone, you feel that sudden difference. That's the reason people complain that their teeth feel weak or they feel gaps between their teeth. That's only because of the tartar being removed. Trust me, there is no issue in cleaning. I get it done myself every 6 months. It's not a problem. It's not going to do any harm to your teeth. But not doing something about it is definitely going to harm your teeth sooner or later. Alright, the next question is, I have a tooth which hurts for a few days and then it is okay on its own. Should I get it checked? Well, as I said, you should get it checked even if it is not hurting. In your case, it has been hurting and then it goes away on its own. So then you know something is definitely going wrong. And there are basically stages of dental decay and gum issues. There are active stages when the problem is exaggerated, you have pain or you have bleeding. And then there are passive stages when the same problem has been controlled somehow by your body. But sooner or later, when the body immunity goes low, the pain starts again. So as I said, if you're having a symptom of any sort, you definitely need to visit the dentist at the earliest and do whatever is required, proper treatment, and then maintain it that way. The next question, okay, Okay, my tooth has always been black. It doesn't hurt. How can I make it white again? Okay, first of all, I have never come across a tooth which was formed black. They may be brown or yellowish in certain cases, but it never erupts black. So if it is black or if it is any other color, come visit a dentist. Let's find out what's wrong with it and do the needful. If it is black because of some external stains, we clean it. If it is a cavity, we do a filling for you. If it is internal stains, it may need whitening. So depending on that, the treatment is done. So best is visit a dentist at the earliest so that we can do what is required rather than delay it anymore. Now, guess that's about all the questions that we had. Just one more. Okay. So how often should I get my mouth and teeth checked even if I don't have any problems? Okay, that's again the same. Don't wait for it. Every 6 months, come visit a dentist so that we can find out exactly what's happening in your mouth before any symptoms start. So that's what I advise, 6 months or twice a year. Let's say put it for Christmas, so that would be your first visit, and then somewhere in the middle of the year, so that you remember that when you clean your house for Christmas, you have to clean your mouth as well. As simple as that. And then 6 months after that. Now I would like to conclude and thank you for listening to me. I hope this has been of some help to you. If you like it, please like it, share it, and maybe somebody else will also benefit from it. Thank you.